With pediatric hospitals under immense pressure, families across Ontario say they're feeling anxious about whether or not they can get access to care in a timely manner. The Ontario Medical Association is highlighting options for patients under what some critics are calling a crumbling healthcare system.
Currently, emergency departments and the healthcare system in general are still experiencing extreme stress.
In Ontario, all hospitals with pediatric patients are currently experiencing 100% occupancy. Calling it a tridemic or triple threat, doctors say the flu, RSV, and COVID have persistently created unprecedented wait times in hospitals. It is why the Ontario Medical Association says families should do their best to explore all options before heading to an emergency department.
The good news with many of these viruses is that for many people, they will be able to manage the viruses at home on their own.
Influenza A is the predominant virus affecting children. The reality is many cases could be resolved with a visit to a family physician, but the most recent data shows close to 2 million Ontarians don't have one.
We are extremely concerned about the doctor shortage.
A problem that is only getting worse as many physicians reach the age of retirement. In Toronto alone, 1 in 5 doctors is thinking about closing their practice in the next 5 years. The OMA says addressing this shortage will immediately help alleviate the burden on hospitals. And they're calling on the government to quickly license more foreign-trained physicians who are in Canada ready to work as doctors.
This immediate solution, if it was implemented, could see hundreds of doctors into our system as early as the spring.
The Ministry of Health tells us they're working to develop and implement a practice-ready assessment process that would allow physicians with previous practice experience to undergo screening and assessment to determine if they are ready to enter practice in Ontario. But for families without a physician, there are other options. Health Connect Ontario can connect families with a nurse. Patients can call 811 to speak with a nurse 24 hours a day. Physical or virtual walk-in clinics are available if needed. Pharmacists can renew prescriptions on a short-term basis. And 101 cold and flu community clinics have opened in Ontario to help ease the pressures on hospitals and can be a great alternative for families.
Effectively diverting some of the volume from our local hospitals.
But if it is an emergency, the OMA says don't hesitate, visit a hospital. Doctors list a few reasons to absolutely visit an emergency room: fever in children under 3 months, difficulty breathing, signs of dehydration or neurological issues, or any other life-threatening issues. The Ontario Medical Association says they're also anticipating a spike in adult patients in the new year, and they're encouraging everyone to get their flu and COVID shots ahead of the holidays. For City News, I'm Yazdani.